Today's video is brought to you by our friends at Shipmate app and cruiseline.com. Shipmate app just rolled out a new feature where you can write a comprehensive review about all aspects of your cruise directly in the app. Just launch the app, click My Cruises, select your sailing, and start your review. Hi there, cruisers. I'm Sherry with CruiseTipsTV.com. Thank you so much for being here. Today, we are going to review the new health advisory that Princess Cruises released last week. So this is a hefty document, you guys. This is 7 pages that goes over some new information about your health and your safety and your well-being on a Princess cruise. Now, we've published a full article about this on our website, which we will link to in the description of this video. If you'd like to read the whole release or a little bit more of a simplified version of it, please feel free to go ahead and check that out. We also have a video announcement from the president of Princess Cruises in that article, so please do take a read and then let us know your thoughts in the comments below once you've watched this video. So essentially, this health advisory is an extension of Princess Cruises' Cruise with Confidence initiative. And essentially, what we're thinking about this document is that this is just the beginning. This is just the beginning of more information to come from Princess and more information to come about the cruise industry. But we really believe that it's critical because Princess is one of the first lines to put out a release like this that really talks a little bit about what to expect pre-cruise, going forward, on board, and what's sort of expected of us as passengers. So while we know this information will become more elaborate in the weeks and months to come as we're all getting close to cruising again, which is inevitably going to happen in the coming months, let's hope, we're going to be hearing a lot more from Princess Cruises and the other lines. But let's get right into it. We're going to start with what Princess is outlining before the cruise. So what to expect before your cruise. Now, the first thing that they talk about in this release is itinerary optimizations. They said we're continuously monitoring the global health map and either canceling or modifying itineraries to impacted areas. Some destinations may restrict or deny entry to ships carrying any persons with symptoms of illness, even if they don't meet the criteria set by the CDC and the WHO. So basically what they're going on to say about itinerary expectations in this particular segment of the article is that they're remaining flexible. They're looking at their fleet right now and they are making some changes. But I believe that they're also kind of indicating that we need to remain flexible as well for the time being, because there is always a chance that a port could turn a ship away. So there's a lot more information on that in the article. Give it a look, but that's kind of the general idea, is that they're really looking at itineraries right now. So we can probably expect some changes and we need to remain very flexible as cruisers for the next little while. So this next part is super important, everyone. This is what we've all been sort of waiting to hear from the cruise lines, and I really love the way that Princess is paving the way. They're calling this section travel restrictions, and what they're saying is that guests and crew members meeting certain criteria will be unable to sail. Now, what they're talking about is certain criteria of illness. Guests who are unable to sail because of a failure to meet the following criteria will be issued a full cruise credit or refund. Now, what they're saying is that if you've been in contact with a suspected or confirmed case of someone who has the virus, let's just call it the virus for now, or a person under monitoring for the virus, or if you are suffering from a fever or flu-like symptoms prior to embarkation, or if you have an underlying severe chronic medical condition, you will not be permitted to board. What makes this particular part of their health advisory unique and different, though, really, is that they are giving you the peace of mind to know that you will get a full cruise credit or a refund. And at Cruise Tips TV, what we've been sort of talking about for the last few months is that what concerns us is that oftentimes we believe that people will go on a cruise ill because they're afraid they won't be able to get their money back, which is obviously, it's a very big sacrifice for someone to make. But now people are being given peace of mind. In fact, you're being told if you meet any of these criteria, if you're not well or if you've been exposed to someone who's not well, you need to call a particular phone number that they have listed and let someone know before you travel to the terminal for embarkation. So I think that's a really huge takeaway here, is that the cruise line is giving you permission to say, look, I'm sick, I can't go on a cruise. And that is a really big pivot for the industry, and one that I really hope that we see the other cruise lines follow suit with. Now, what can you expect prior to embarkation or at the terminal? The first thing that Princess is saying will happen is thermal scanning of all guests and crew. As soon as possible at all embarkation terminals globally, they will be checking body temperature of all guests intending to board their ships. Anyone presenting with fever or flu-like symptoms will be denied boarding. They're flat out saying, irrespective of recent travel history, you are just simply not going to be able to board if you present with any of those issues, and you will be given a full future cruise credit or a refund. So again, they're being very cautious. They said that they're also going to be working on health screening of all guests and crew. They're medical experts or coordinating closely with the international health authorities, and together they've developed a written traveler's health declaration to be completed by all guests and crew prior to boarding. And they also say very firmly that false responses on those pre-boarding documents will result in immediate disembarkation at the next opportunity, and people who do not disclose symptoms of illness may also face legal consequences. So things are getting very serious here. They're also saying that they will offer some secondary screening. For some people, they will need to go through some kind of a secondary health screening, and they are going to be offering medical staff at the embarkation terminal to help out with that prior to embarkation. We don't know a whole lot about what those health conditions are right now, but I'm sure that as we learn more, we'll be sharing that with you. They're also going to be putting into place some heightened sanitation of the cruise terminal. So more sanitation protocols, thorough cleaning of hand-touch surfaces before and after each sailing, fogging each terminal before embarkation and debarkation. That's pretty new. I don't think that they were fogging terminals before. And hand sanitizers in the terminals be placed in easy-to-use locations for all staff and guests. We're going to be seeing a lot more sanitization. Also, if you are going to be taking a transfer shuttle or boarding a bus, those particular modes of transportation will also be sanitized. Sorry about the tongue twisters in this release, you guys. There's a lot of tongue twisters apparently. So now let's move on and talk about what you can expect on board a Princess ship now. This is something that a lot of us have been waiting to hear about. They are going to start with enhanced sanitation and health measures on board all ships. So in addition to their existing rigorous daily cleaning regimen and standards, they're doing more. So let's talk about what more means. More frequent sanitizing of tables, chairs, menus, and other surfaces in restaurants and bars before and after service hours. Here's an interesting one. More frequent open deck sanitation of sun loungers, outdoor furniture, mini golf, sports equipment, handrails, etc. That sounds new to me. Additional sanitizing of frequently hand-touched surfaces in all public areas and lounges, restaurants, lobbies, elevators, handrails, public phones, counters, games, casino chips, slot machines, fitness machines, children's toys, and security screening equipment. You name it, it's going to get cleaned more frequently. They also said, and this is another big one because this has to do with food service, wherever possible, staff will serve guest and crew food stations, including the buffet and ice cream machines. Where it's not possible due to layout restrictions, dedicated personnel are posted to monitor those stations and ensure that they are cleaned and sanitized in a timely manner. In any self-service areas that remain, serving utensils will be replaced on a frequent basis. So we're looking at like self-serve areas like buffets and ice cream machines, total elimination of self-serve, but where it is not possible logistically, more monitoring. It'll be very interesting to see what that actually means and where it's possible and not possible. Now, stateroom surfaces will be thoroughly cleaned up to twice daily with particular attention to bathrooms and surfaces frequently touched. All corridors, including handrails and stateroom door handles, are frequently sanitized as well. And during instances that a guest or crew displays flu-like symptoms, their stateroom will receive additional deep cleaning. There will be more hand washing sinks and more sanitizers all over the ship. I'm going to go ahead and just kind of paraphrase that. There will be more hand sanitizers in highly trafficked areas, guest and crew areas. Now here's a new one. The temperature in their washing machines and dryers has been increased for enhanced disinfection of laundered goods. Also, guest laundrettes, so where you do your guest laundry, they've got those set at the highest wash and dry temperature as well. That's a big change, guys. They're also going to be taking on more frequent cleaning and sanitization of public restrooms. I think that's great. We need to see more of that. They're also raising crew awareness and taking on more steps to enforce crew hand washing. So the important words there were enforce crew hand washing and providing more hand sanitizer dispensers in crew areas. And some guest-facing crew may wear masks sometimes, not all the time necessarily. They're also going to be communicating daily health advisories and televised healthy tips to all guests. And this is interesting, all public lounges and restroom doors will be propped open to reduce door handle touch points. I like that. I don't like touching the restroom door, especially when there's not a little, paper towel dispenser to open the door with. I think that's terrific. They're also going to be making sure that they have an increased onboard supply of medical and personal protective equipment, also known as PPE supplies on board. And I believe that that's probably being required of them by the CDC. All right. They're also encouraging any guest or crew to visit the medical center if they experience respiratory systems. I'm just going to kind of paraphrase that part as well. So here's the sort of close of this document that was released. And this is the part where Princess asks you to take control of your voyage and to take control of your health. And they're putting some responsibility and some onus on us as the cruisers. They want us to focus on prevention and reporting. So here's what they are saying. The following healthy travel habits are recommended by the World Health Organization and the U.S. Centers for Disease Control and Prevention. Wash your hands, use alcohol-based hand sanitizer, avoid close contact with people suffering from respiratory illness. That's new. They used to say gastrointestinal illness was the thing you wanted to avoid, but now they're saying to stay away from people with respiratory illness. Cover your nose and mouth when you cough or sneeze using a tissue or your bent elbow. Avoid touching eyes, nose, and mouth. Get a flu vaccine. They're recommending you get a flu vaccine. Where possible, use your elbow instead of your hands to operate frequently touched surfaces such as door handles and elevator buttons. They're also, again, stating you need to go to the medical center if you experience any respiratory illness, and they elaborate on what that means. Now, here's how they want you to prepare. These are some big changes, some really big points, and I think that they have learned a lot from the Diamond Princess experience. In fact, they say that some of this caution is based on their recent learnings from Diamond Princess, very specifically. And here is what they are asking of us as cruise passengers. They are asking us, strongly encouraging us to pack 14 days of extra medication, along with bringing the list of names, strengths, and dosages of all medications in case refills are required. They are asking you to provide a valid emergency contact in the cruise personalizer when you register for your cruise. And here's a new one. They are asking you to enable an international travel plan inclusive of voice and data when you take a cruise. They said that cell phones will not work the same in all countries without an international plan, and Wi-Fi is not always available in some countries. So that is what the cruise line is asking. Get an international plan, take it into your own hands, take control of the situation. And lastly, they are asking that we purchase travel protection. We strongly recommend, they say, that you purchase Princess Vacation Protection or some other form of travel insurance, not only to protect you from any losses stemming from unforeseeable circumstances during your vacation, but also to have the flexibility to make new plans with the cancel for any reason coverage offered by Princess Vacation Protection. So, I know that was a lot. Hopefully we were able to simplify this 7-page document a little bit so that it's easy for you to understand, but I think that this is an excellent look into what is to come. Now, I know that all of you are wondering what extra health protocols and requirements are going to be in place before they resume operations. Who's going to be allowed to sail? Will there be age restrictions? Will there be health restrictions? Now, Princess has said that they are going to be supplementing this document by developing several additional new health protocols, which they will share before ships resume operations. So it sounds like that is underway. It hasn't been released yet. I'm sure they're working with the CDC and the WHO to get that all figured out. And I'm sure we're going to see some standardization across the lines with regards to those limitations. And we're all very eager to find out what those are because it's very concerning to many people. They want to know, will I be able to cruise? Let us know what you think about all of this new information, and let us know when you will feel comfortable cruising again in the comments below. We would love to hear from you. Thank you so much. Please continue to follow our website, CruiseTipsTV.com, for continued news updates, and we will be back with more very soon. Until then, we'll see you on the high seas.